Welcome to our channel. Are you tired of dealing with lower abdominal cramping pain and wondering what could be causing it? In this video, we'll dive into the common causes, potential treatments, and when to seek medical attention. Stay tuned to learn how to manage and alleviate your discomfort effectively. Lower abdominal cramping pain can be a symptom of many different conditions, making it essential to understand the potential causes to determine the best course of treatment. This comprehensive guide delves into various causes, treatments, and the importance of seeking medical attention when necessary. Common causes of lower abdominal cramping pain: menstrual cramps. Menstrual cramps, or dysmenorrhea, are one of the most common causes of lower abdominal pain. These cramps occur due to the contraction of the uterus during menstruation. Prostaglandins, hormone-like substances involved in pain and inflammation, trigger these contractions. While menstrual cramps are typically manageable with over-the-counter medications and home remedies, severe cases might indicate underlying conditions such as endometriosis or fibroids. Gas and bloating. Gas and bloating are other frequent causes of lower abdominal pain. Gas accumulates in the digestive system when food is not digested properly. This can result in discomfort and cramping. Foods that are high in fiber, carbonated drinks, and swallowing air while eating or drinking can contribute to gas buildup. Constipation. Constipation can cause significant lower abdominal pain. When stool moves too slowly through the digestive tract, it can become hard and difficult to pass. This can lead to cramping, bloating, and discomfort. Ovarian cysts. Ovarian cysts are fluid-filled sacs that develop on or within the ovaries. While many cysts are harmless and resolve on their own, larger cysts can cause severe cramping, pain, and other complications. Endometriosis. Endometriosis is a condition where tissue similar to the lining inside the uterus starts to grow outside the uterus. This can cause chronic lower abdominal pain, especially during menstruation. Endometriosis can also lead to heavy periods, pain during intercourse, and fertility issues. Pelvic inflammatory disease, PID, is an infection of the female reproductive organs. It is often caused by sexually transmitted bacteria. Symptoms include lower abdominal pain, fever, unusual discharge, and pain during intercourse or urination. If left untreated, PID can lead to serious complications like infertility. Irritable bowel syndrome, IBS, is a chronic condition that affects the large intestine. It causes cramping, abdominal pain, bloating, gas, and diarrhea or constipation. The exact cause of IBS is unknown, but it is believed to be linked to stress, diet, and other factors. Appendicitis. Appendicitis is the inflammation of the appendix and typically requires immediate medical attention. Symptoms start with pain around the navel, which shifts to the lower right abdomen, and is often accompanied by nausea, vomiting, and fever. Treatments for lower abdominal cramping pain: over-the-counter medications, nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen. Naproxen can help alleviate pain and reduce inflammation associated with menstrual cramps, gas, and other minor conditions. Heat therapy. Applying a heating pad or hot water bottle to the lower abdomen can help relax muscles and relieve cramping. Heat increases blood flow to the area, which can reduce pain and discomfort. Dietary adjustments. For those experiencing pain due to gas and bloating, dietary adjustments can be beneficial. Reducing the intake of high-fiber foods, carbonated drinks, and foods that cause gas can help. Staying hydrated and eating smaller, more frequent meals can also alleviate symptoms. Hydration and fiber intake. Increasing water intake and consuming fiber-rich foods can help. Thank you for watching. If you found this video helpful, Please give it a thumbs up and share it with those who might benefit. Don't forget to subscribe to our channel for more health tips and information.